Gut Health with Datuk Dr. Krishnan Sriram, Consultant Colorectal and General Surgeon.
Hi everyone, I'm Datuk Dr. Krishnan Sriram, Consultant Colorectal and General Surgeon from Gleneagles Hospital, Kota, Kinabalu. Today we are going to discuss and talk about anal fistulas and perianal abscesses, what they are, their symptoms, and how to diagnose them and how they can be treated. If you or someone you know is experiencing discomfort in the perianal region, this information can be very helpful. So let's get started.
What is anal fistula and perianal abscesses?
Firstly, let's understand what is anal fistula and what is perianal abscess. Anal fistulas and perianal abscesses are very painful condition and they usually affect the areas around the anus. Sometimes it could also go slightly beyond that. Early treatment is very important to prevent progression of the disease. Perianal abscess is actually a collection of a pus. It forms around the anus, and this is often due to the infection of the anal gland, and the patient usually presents with severe pain, swelling, and redness. Sometimes could also have a bit of pus discharge as well. Whereas the anal fistula is the abnormal tunnel which develops from the infected glands, and this tunnel connects from the anal gland to the skin outside. So there is a communication between the anus and also the skin outside, and usually there's a pus which drains out through this opening. These conditions can be very uncomfortable. They can interfere with our daily activities and affect our quality of life. So it's important to seek medical attention if you suspect you have an anal fistula or abscess.
How to diagnose anal fistula and abscess?
Secondly, let's talk about how we're going to diagnose anal fistulas and perianal abscesses. Diagnosing anal fistulas and perianal abscesses involves a very thorough physical examination and also history taking. So when we examine the perianal region, usually we look for swelling, redness, is there any pus draining out, or as any opening can be seen as well. So when we talk subsequently, when the doctor will probably ask you about your symptoms and all that we want to know basically whether you have pain, is there any discharge and what type of discharge is coming out, and basically is there any change in your bowel habits as well. So this helps us to understand how the disease has been going on. It's also for us to decide whether this is something that's acute or is it something that's been going on for a long time. So imaging is very important for us to decide on the treatment of anal fistulas. This could include an MRI or an endoanal ultrasound. Both the tests usually helps us to visualize the path or the track where the fistula is going on, and also to assess whether the abscess is just localized or is it in multiple areas as well. Knowing the fistula's location and extent is very crucial, especially for us to decide on the treatment subsequently. This helps us to give you the best treatment possible in terms of curing your anal fistula.
The management of anal fistula and abscess.
Okay, finally, let's talk about the management of perianal abscesses and anal fistulas. Both for perianal abscesses and anal fistulas, the key treatment is always surgery. There are other options such as antibiotics and non-surgical options, but these are actually to reduce the pain, discomfort the patient goes through. But when we talk about definitely surgery. For perianal abscesses, the key treatment is actually to drain the pus. How extend the drainage of pus depends on the location, how deep the abscess has gone through, whether it's a single or multiple abscesses. Whereas for perianal fistulas, the treatment need to be individualized and tailored according to the site, complexity, and severity of the condition at the time. So there are few options available for the treatment of perianal fistulas. So some of the commonest things that we always do first is fistulotomy. Basically, is involving the cutting open the fistula tract and letting it heal from inside. Sometimes this procedure will be combined together with sphincter repair, just in case the sphincter need to be cut during the procedure. The next procedure is called lift, which is ligation of intersphincteric fistula tract. Basically, we are separating the tract by ligating it in between the internal and external sphincter muscles. The next option available is actually laser surgery, which is called FILAC, fistula laser surgery. So basically what we're doing is we are ablating the tract using a laser fiber and hoping that the tract closes down. Yeah, and the more advanced procedure such endorectal advancement flap basically is moving the tissue inside the anus and rectum to lower down and to close the internal opening. As I said earlier, the treatment for fistulas need to be individualized, and sometimes we need to use a combination of techniques as well. So early diagnosis and treatment is very crucial. These steps can actually prevent complications and recurrences. The prompt medical attention can lead to a better outcome. So basically, when you talk about anal fistulas, there should always be a balance between the risk of incontinence and risk of recurrence. And patient's outcome is the most important part in this.
Conclusion of anal fistula and abscess.
As a conclusion, early diagnosis and treatment is very crucial. For perineal fistulas, we have to be very careful because sometimes there could always be an underlying fistula together with it. Detecting it is very important. Whereas for anal fistulas, the treatment is very important to balance between the risk of recurrences and the risk of incontinence. So hence the treatment has to be individualized and tailored according to each patient. These steps can prevent complications, reduce recurrence, and end of the day leads to a better outcome. Thank you everyone, and hope to see you guys again in our next video for the new topic after this.